I've had the pleasure of attending the 2017 ASBMR meeting, where there have been a large number of fascinating clinical presentations and clinically relevant discussions. One theme during this conference has been a focus on osteoporosis diagnostic strategies. We saw a presentation of more analyses from the SCOOP trial from the UK, which demonstrated in a large randomized controlled trial that population-based screening of bone health based on FRAX and bone density led to greater usage of osteoporosis medications, improved adherence to these medications, and most importantly, reduced rates of hip fracture by 28%. In contrast, the ROSE study found that a similar population-based screening strategy in Denmark did not reduce fractures, perhaps due to an unexpectedly high rate of osteoporosis treatment in the non-screened group. In another important screening study, the FOCUS study demonstrated the feasibility of repurposing CT scans obtained for other clinical reasons to analyze bone density and fragility measurements to increase the diagnosis of osteoporosis. Data exploring new DEXA-based screening tools were also presented. In addition to many abstracts on TBS, there were tantalizing new data about the ability of DEXA-based finite element analysis to estimate hip strength from the Manitoba BMD cohort, as well as several abstracts using DEXA-based 3D analysis of cortical hip geometry to predict fractures and identify high-risk patients. Another common thread during this meeting were studies that identified the complex interaction between obesity, metabolism, and bone health. A large analysis in type 2 diabetic patients from the Swedish National Patient Register identified that longer duration of diabetes and worse glycemic control, as indicated by high hemoglobin A1C levels, were predictors of increased fracture risk compared to other diabetic patients. Meanwhile, data from the Mr. Oz study found that sarcopenia is a predictor of fractures, even in the setting of obesity, with patients with sarcopenic obesity having increased risk of falls and a 2 to 3-fold increase in fracture compared to non-sarcopenic, non-obese patients. Finally, 5-year rates of bone loss after gastric bypass weight loss surgery were reported to be approximately 10 to 15% at axial and peripheral sites and occurred despite plateau in weight, suggesting weight-independent mechanisms of bone loss in this population. On the treatment side, subgroup analyses of the head-to-head Vero study showed that teriparatide reduced spine and clinical fractures more effectively than risedronate among postmenopausal women across all analyzed subgroups. There was also a lively debate about whether treatment during the menopausal transition was helpful in reducing fractures later in life. On one side, Dr. Erik Eriksson provided an impassioned defense of hormone replacement therapy in younger postmenopausal women, citing fracture benefits as well as improvements in menopausal symptoms and metabolic outcomes. On the other side, Dr. Gail Greendale reviewed that rates of bone loss across the menopausal transition vary widely, but do not appear to predict future risk of fracture. And while both sides noted that HRT does not continue to protect against hip fracture after treatment discontinuation, there's debate as to whether there continued to be protection against other fractures, and also as to whether accelerated rates of bone loss after treatment discontinuation negated the beneficial effects in the long term. Overall, this year's ASBMR meeting highlighted many compelling discussions of scientific research from an international gathering of researchers and clinicians interested in bone and mineral research.